All right, let's see if we do this fancy stuff. Okay, so just a little context. Who was given hour-wise? Julie up here. What's their connection to rare disease? I just want to let you know that we've been a mental health organization for over 21 years in the U.S., and we actually started in service of the military, actually, because we were concerned about how military folks and their loved ones weren't able to find resources, mental health resources that spoke to their lived experience that felt safe. So we basically created a shadow network of clinicians outside of behavioral health who agreed to give an hour a week for a year to see individuals who came to us for care that was free and confidential. Over the years, we've continued to expand out the populations that we pay attention to. And the way that we got into rare disease work specifically was actually an industry partner came to us and said, every time we talk to a patient advocacy group across rare diseases, the number one thing that we hear that people struggle with is mental health. And we don't have any resources that feel very specific to the rare disease community. So we want to talk about that with you today, not only to raise the issue as an important conversation, but also give you some tools and perspectives about how to pay attention to mental health. Well, let's talk about specifically what are some of the mental health impacts of NMOSD. What are some of the things that come along with the physical journey of having this rare disease? So first thing I always have to do with any audience is let's level set. Let's just talk about the stigma behind mental health. First of all, mental health doesn't always mean bad stuff. Oftentimes when we say that, oh, I'm concerned about her mental health, you're inferring that anything mental health-wise might be dysregulated or not good in some way. But mental health is just a part of being human. It's all of the experiences. It's not necessarily something bad. Everyone around you is touched by mental health, both their own and the others around them. And what we find to be really exciting at Given Hour, even though we do have 3,500 mental health clinicians in our network, we believe in the power of non-clinical care as much as we believe in the power of clinical care. And when we say non-clinical, what are the things that you can do by yourself? What are the things that you can do with community that can have incredible impacts in the way that you feel every single day? Not just in your body, but in your brain. So I also want to just mention about trauma. Because what I've really found over the years of working with rare disease communities is a lot of the stories that I hear qualify clinically as examples of trauma. So what is that? So trauma is not the event itself. We talk about this a lot. Trauma is what's left after something has happened, right? So it is the emotional or psychological or the physical impact. When my partner came out of his first spine surgery, they did not manage his pain well. And that caused him to be in incredible distress. And from that experience, he is now traumatized. He's been traumatized by the medical profession, right? He feels traumatized that he's not listened to, he's not believed, he is not validated, he's not going to be helped. So when a medical issue comes up for him now, the trauma of what happened to him in the past impacts the decisions that he makes today about his health. Makes a lot of sense, right? Our previous experiences inform how we respond. Someone who has been traumatized means that they are having some type of emotional or physical response that feels overwhelming to them in that moment. It feels like it's coming over them. Sometimes people don't even know where it's coming from. I know that, I will have waves of panic that come up in my life. And I'm like, what am I doing right now that's making me feel this way? I'm not even thinking about anything that's stressful to me. But it might actually just be residual panic from a conversation I had 2 hours ago about an upcoming appointment, or my doctor sending me a note, and that I, in the moment, felt like I handled okay. And 2 hours later, my body's in a state of panic because I wasn't able to emotionally process it, but my body was still going to process that trauma. It's also important to know that two people can go through the same event and have different emotional responses to it. And a lot of times that comes from the previous experiences they've had in their life. So if this is the first bad thing that's ever happened to you, like really, really, really bad that's happened to you, you may actually be more resilient than someone who's had many, many, many hard things happen to them in their past, because when you're re-traumatized with a new event, it often brings up all the feelings of other traumas that you've had in your past. I worked with a dad in the UCD community who is such a solid rock. Man, he is such a great dad. 3 girls. He and his wife are just people of faith, just working really, really, really hard to help their daughter who's living with a really challenging medical diagnosis. And he has been the one to be the emotionally strong one. She had an incident at school where she had a behavior change and her seizure manifested in a different way. Within a week, he attempted suicide. And his wife reached out to me. I knew them. And she said, I don't understand. Like, we've had so many harder things than this happen before with her. Like this was just something moderate. What's going on? And so as I consult with the psychologist that we consult with, what we really understood is that, I'll call the guy Josh. Josh had actually had diagnosed depression when he was an adolescent. He had actually had some thoughts of self-harm as he went into college. Through his marriage and having his kids, a steady job, even through some of the traumas of the diagnosis, he was able to manage and maintain. But something about this specific incident re-triggered him, and he all of a sudden was having the same emotional struggles that he was having much earlier in his life. So trauma means that sometimes people's behaviors don't line up with what they're experiencing in the moment, and that can be really confusing.